Hello, everybody, and welcome to another episode of Career Diaries by Elemed, the podcast dedicated to talking about careers in the MedTech industry. I am super excited to have with me Philippe Bastide, CEO and co-founder at Dianosic. And Philippe, can you tell us a little bit more about who you are and what your company does?
Hi, Elena, and thank you for having me joining this event. Well, a couple of things about me. So you mentioned it before. My name is Philippe Bastide. I'm the CEO of a company called Dianosic. I've been in the industry space for quite a long time now. I started in pharma at Pfizer a long time ago, where I was in charge of market access topics at the French affiliate level. After that, I had the opportunity to embark on a medical device venture at Johnson&Johnson, more specifically Ethicon, where I continued to be involved in market access, but at a European level, at an EMEA level, as we say. And I was in charge of the hemostats portfolio for that company. Soon after that, I had the great opportunity, and I think we'll come back to that in a moment, to lead the effort of developing a startup company acquired by J&J called Acclarent, which was involved in the field of ENT, which is really something close to my heart. And I was a business unit lead for a couple of European markets, plus Middle East. And I had also in charge of professional education in EMEA. So that was really the first time I had a chance to get my feet in the business ground, so to speak, after this market access experience. Mm-hmm. I then joined a company called Livanova, mm-hmm. where I spent a couple of years. The company is involved in the cardiovascular and cardiac surgery field. And I was actually supporting startups incubated at New Ventures. That was the name of the group in which I worked at that time. And I was helping those guys from startups, but also internal projects, extremely innovative, to move forward, in particular in the field of market access once again. And then we arrive at Dianosic. That's an interesting story. I was still at Livanova when one day my phone rang, and a former customer of mine from Acclarent told me, yeah, Philippe, I have an idea of product. There are a couple of unmet needs in the field of ENT. What do you think about that? And I knew the surgeon was a French surgeon, was extremely creative with a lot of ideas, but I was not so sure, even though I found this very exciting. He came back to me a couple of weeks later insisting, and I was really thinking the idea was good. So I started to pressure test the idea with a couple of other people I knew in the field of ENT. And really that sounded like something attractive. And then I just made my decision to really change world and move from the corporate space to reach the startup space. That's how everything started.
And so tell me a little bit more about your company and kind of the products there that you guys have.
Well, as I said before, we are dedicated to ENT, ear, nose, and throat, and more specifically to the nose part. We are interested in two particular areas. The first one deals with epistaxis or nosebleeds in general, but also to other, let's say, mechanism that intervenes in the nose And the first product that we have developed, which is an asymmetric balloon that you inflate in the nose that conforms nicely to the anatomy, can stop bleeding, but it can do also other things for other procedures like septoplasties or ethmoidectomies. I'm not getting into the details, but this is really an interesting technology that we just started to deploy. And in parallel, we are working on a longer term project in the field of chronic sinusitis with a resorbable implant that you leave inside of the nose for a long period of time, approximately 12 months. And in this device, you have a steroid that is encapsulated and that will elute over time to treat the underlying disease.
So like a combination device then?
Absolutely, that's a combination device.
Nice and complex. I'm sure the regulatory people would be loving that.
A nightmare.
So coming back to your story then, so it's really interesting, obviously, because you started off in big corporate, then you kind of had these glimpses into the startup world, but still being obviously backed by big companies, and really living that corporate life at the beginning, for sure. That is a question that a lot of people frequently ask, should I go from my role in a big company to a startup? What pieces of advice would you have for people that may be thinking about that?
That's an excellent question, and I went through that myself. What I can tell you is that if you start thinking too long, if you start making things extremely rational with two columns, the columns for the plus, the columns for the minus, even if the plus column is full of things, it will, be very easy for you to find one element in the minus column to say, I won't do it. So just do it and don't think about the minuses, because you will find minuses. And I think there are too many people finding bad reasons not to do it.
What do you mean by bad reason?
Well, bad reasons is very often it's too risky. That's one. I will lose the comfort of being in the large corporation. What about my salary? What about my family? Those types of things. So the first thing you need to secure is really having your partner supporting what you do. If you don't have that, it can create a lot of frictions, and the rest will not follow naturally. So secure that first, which I did, and then just focus on the good reasons. I want to be excited about something new. I want to do something on my own, which is very rewarding, starting from literally zero, and bring that to the market, to the patients. Those are the good reasons.
It's really interesting because, when we talk about startup, the word that always comes out is risk, right? So especially when we're talking about careers, and frequently that's kind of the number one objection, I would say, especially for people that are employed by big companies that are concerned about moving to startup. It's too risky, because of all this kind of press that's associated with startup companies failing. But I have to say that it's going to be interesting to see, over the next year, even how that sentiment might have changed, because I think something that we've seen with COVID is it doesn't matter the size of company that you're in, there's always a risk in the end. You could be in the biggest, most corporate company. I mean, if we look at some of the stuff that's happening, Virgin are cutting jobs, a very well-known established company that you would have said, okay, maybe they're a bit more secure. But actually, I know people that are in startups that have kept their jobs, continued growing, continued, all the great things associated. But equally, I've seen people in huge companies that have been cut because of COVID. So it doesn't necessarily mean that big companies equals more more safety, actually?
Absolutely, that's absolutely right, and you can be made redundant very easily nowadays. So don't wait to be in your late 50s to think, well, the startup can be an exit door. That's not an exit door. That's an opportunity, and you will discover how rewarding it can be when you embark on such a venture. The sense of accomplishment has nothing to do, really, for me, and that's my opinion. Nobody is obliged to agree with that. In my view, the sense of accomplishment is x-fold more important than in a large corporation. You have this, as we say, this helicopter view. You take a project, you bring it from zero, you create a prototype, you see your first prototype, then you have your prototype fully functional, and you have your first patient. Then you have your product approved, CE-marked, and then you have your first invoice, and then you start, selling routinely. All those elements, you don't see them in the same way, at least when you are in the large corporation. You are in a small space, and you operate in this small space. That's by design how you work in large companies.
Yeah, it's so true. I think it's something, even if I related to my own career history, I used to work for a big corporate recruitment company, and then I started Elemed, and the worlds are very, very different, in terms of kind of the fact that when you're in a startup, you basically do everything, right? You have a job description, but if you see a gap and nobody's covering it, you have to adapt, right? And we do a lot of recruitment for startups, and something that comes out over and over again, especially when we're talking with CEOs of startup companies, is around attitudes and around personality, as well as skills. Do you think that everybody or anybody is cut out to work in a startup? Do you think that any personality type would work well in a startup? Or are there certain things that, you could say maybe to some of our listeners, if you have this, startup life could be one for you to really consider?
Well, I think if you are not a risk taker, you should forget about it. That's my humble opinion on that, because for sure we take risks. So either you are ready to take risks, and personally, I see the glass half full from that standpoint, meaning if something goes wrong for some reason, that can be the case. You mentioned that before in startups very often. People are all often thinking, well, what am I going to do? Because if the startup collapses, what comes next? I will struggle to get back to the corporate world. Where are my opportunities? I think you should not, again, have a negative approach of failure. You should think that failure can also create opportunities. That's very American. French people don't think like that very often. Failure is not well perceived. Failure will close doors moving forward. No, that's not true. With startups in the US, for example, if you did not create a first startup that failed before you create a second one that will eventually succeed, investors will look at you in a strange way. You will be suspicious because failure is part of the game. So I think you have to consider failure as an opportunity. Mm-hmm. And then once you have that in your mind, you can take the risks and they are no longer a problem.
Mm-hmm. Mm-hmm. I think it's absolutely critical, and it's one of those great interview questions as well, and I think the best interviewers ask this question: tell me about your failures. Tell me about your successes. Yeah, I want to hear about your achievements, but in particular, tell me about your failures, because there's so much that you get out of failures in terms of, and listening to people speak about them, like yes, it went wrong. Why did it go wrong? What would you do differently? What did you learn? You know, and also I think the worst thing that anyone can do is go into an interview and say, I've never ever failed. But you know, I think failures are a natural part of life, and especially in the startup world. And more important is how are you able to react? You know, how are you solution oriented? So if something fails, okay, what can we do differently? Or if something is about to fail or failing, how can we rescue it? It's more that kind of mindset that I see, especially in people that are successful in startups. What would you say the other kind of major differences that people need to watch out for?
Well, so we mentioned that being a risk taker is important because you take risks by definition. I think you need to be extremely persistent as well, and adaptable to changes, because on a daily basis you may have to change things to react quickly to an event which was unexpected, and those are the typical features that are, in my opinion, required for an entrepreneur. Mm-hmm. If you don't have that, that will be difficult for you. Example, you have a product, looks beautiful, it addresses an unmet need, but for some reason, at some point, it does not fly. You don't know why, but there is something going wrong. If you, let's say, really persist, but you know, in a negative way, meaning you become stubborn, you need to persist, of course, but at some point you need also to pivot. And if you don't pivot, you can just kill your project and kill your startup. So be adaptable, you know, be persistent, but at some point realize that it's not going to fly and pivot. We did that with our company already in various occasions, and that's probably why we are still there.
It's critical, that idea of being able to pivot and being adaptable, and also being able to keep a cool head when dealing with major issues, I think also, right? And the pressures of I'll give you an example. It literally just happened today. Literally just happened. We've been working on a salary calculator for the last, can't even tell you how many months. It's been an ongoing project for a very long time. It's been built up, and we literally a few hours ago launched it. So we sent it out to our mailing list, published it on LinkedIn, and guess what happened? Our website completely crashed. So imagine we had thousands of people going onto the website to download this report, and the whole thing went down. So Mathilde, our marketing manager, you know, all of a sudden had to jump into this mode of, I need to manage this crisis now, right? Like, get onto the website hoster, make some phone calls, and within 30 minutes she had it fixed. Now, some people might not be able to you know, that might be something that would make them freeze, and it would be days and days to try and fix it. Whereas, like, you know, it's being able to prioritize and stop what you're doing, deal with immediate issues, and have to just find a way, find a solution. So there's loads of examples like that, I think, in startup companies, and I'm sure you've got loads yourself.
Oh yeah, sure. That's interesting what you say, Elena, because you know, I remember in large corporations, you tend to be as organized as you can. So you have, it's a bit of a caricature, but you have a shopping list, and you tick the first box and the second one, and at the end of the day, the things you had on your plate are done. In a startup, you cannot do that because of what you mentioned. This can happen, you know, in 5 minutes. Someone will call me and tell me we have a crisis. I need to run. That's our life, but that's also what makes it very exciting.
Yeah, and it keeps the energy going, and you know, no 2 days will ever be the same.
No,
startup. That I can guarantee. Well, look, I'm glad that you're having a good experience of it. And so, okay, so what would you say? You know, I want to talk to you about MDR. You know, because the medical device regulation is something that obviously, you know, is having a major impact on the medtech industry. I read your article, which was a bit controversial. But I like a bit of controversy, actually. So for me, it was really interesting. But you know, I go to loads of conferences and people are always talking about the impact to startup companies and, you know, this is killing startup companies. So as a CEO of an up and coming startup in MedTech, what is your take on the new medical device regulation?
I think we would need an extra 3 to 4 hours to discuss that. But no, first, what I believe is that there was a need to change the way devices in general have been evaluated for the past 20 years. We have seen some companies. There is a famous French one, PIP, you know, cheating the system, and there was really a need to implement new rules so that it does not happen anymore. Once you have said that, it comes to what do you need to implement. I think that the directive was not perfect, clearly, but we are moving from probably something that was not enough to perhaps something that is in some instances a bit too much. And too much means, in our case, we are, for example, with our asymmetric balloon, we are a class 2A device. The ton of, even though we were not submitted to MDR at that time, but the ton of information that is now required, despite what I consider being a minimal, you know, level of risk with a product like that. The ton of information is just incredible. So it's very cumbersome for startup companies. It becomes extremely expensive, and we need to bear that in mind. We deal with notified bodies, which are either semi-public structures or close to completely private structures, and they charge you for their services. And MDR is inflating, you know, this cost for startup companies. So I think it's something that will, let's say, add a bit of quality in the system, but at what cost? I'm just wondering. The cost is for me probably a bit too high, especially for some particular products, low risk devices, and I'm really challenging that. Mm-hmm. What I believe as well is that clearly, even though there was a need to change something, modifying the way devices are evaluated was probably not enough. It should have been a good opportunity to reflect on who is evaluating devices. I'm personally a big advocate of having EMEA, the European Medical Agency, in charge of devices evaluation. I think having notified bodies in charge of that, and that's controversial. Now we talk about controversy. I think it's controversial, but I genuinely believe that the future is in the hands of the EMEA. Like what FDA is doing. You know, it's no big difference. They are in charge of devices and drugs. We could probably do the same in Europe, even though it will take a long time.
Do you think it will go that way? Because I have heard conversations around that, but then the argument the counter argument I heard was, if they wanted to do that, they would, you know, they would have done it. But you know, there is a need for notified bodies in the market. You know, further scrutiny of notified bodies was needed. That's why they put in also all these extra, you know, requirements, you know, towards notified bodies, as well as notified bodies filtering it down onto the manufacturers. But I've heard the counter argument that there is a need to have a system that uses notified bodies as opposed to a system like the US.
Personally, I do not support that statement, but that's part of the controversy I highlighted on my post on LinkedIn. I think you know, as a base, it's always better to be evaluated as a company by a fully public entity. You may become suspicious when you have private companies charging you for their services when it comes to approval of medical devices and CE marking. I think it would be better if a public European structure would actually be in charge of that. That's the base. Then we can discuss the details. We can discuss what would notified bodies become in the future, what they would be in charge of. This is clearly not something I gave a lot of thought about. But the base should be for me this public entity in charge of the evaluation.
If you're an outsider looking in, and not really, if you don't know too much about the intricacies of the medtech industry, you would assume that's how it's done, right? Because if you look at any of the other industries, if you look at pharma industry, if you look at chemical industry, it typically works, as I understand, like that. And obviously you're coming from, you said you came from Pfizer, so you've obviously seen how it works on the pharma side. So then there's probably, that there would be arguments for and against, I would imagine, but it's definitely a controversial point, and I'm sure the notified bodies, people that are listening to this have definitely got their point of view and their justifications on that.
But just one thing to mention, Elena, which is important. You talk about people from notified bodies that may listen to our conversation. They are good professionals.
For sure.
Not against them. It's against the way the system has been designed. It's nothing more. And I think you can't just say the things are set in stone and will never change. It can change, but there will be some resistance. There will be some arguments and counter arguments. I just told you in which camp I am. That's all. I don't pretend I have the truth.
No, and I think it's definitely an interesting concept. Definitely an interesting concept. And what I think we are seeing is an assimilation towards similar processes that we are seeing in pharma, right? So typically it's widely understood that in terms of the way things are regulated and in terms of the processes that are set up and, the way that even the jobs are done, what we see is that, pharma seems to be a little bit more mature as a market. And so, with the new regulation, all this extra requirements on, the post-market and the clinical piece, it seems to be closer to what the pharma industry already kind of has in place, right, with pharmacovigilance and such activities. So there is an argument, and who knows what the future will hold. I mean, who knows what the system's going to look like in 20 years, but it's definitely an interesting point to make. I want to ask you about innovation with MDR though, because the other kind of like big topic that comes out of this is it becomes much more expensive to have a startup company in Europe. It is more difficult to get to market, takes longer, the burden is higher. Therefore, startup companies in Europe are going to decrease, or their startup companies that are outside of Europe will not look to Europe as their initial, market of entry, which is historically what a lot of companies did. They went to Europe because the burden was a little bit lower than if you were to look at the US. What do you think is the impact of MDR on innovation in particular?
Another tough and good question. I think what we have observed over the past couple of years is a sort of shift between Europe and the US. Like 10 years ago, even a bit less than that, companies had a tendency to go to Europe with medical devices because it was easier.
Yeah.
Now with the MDR, it becomes extremely complex, to say the least. And so at the same time, the US also had discussions at various levels, and we're thinking, okay, what can we do to attract companies in the US and be ourselves, as a healthcare system, more attractive, more welcoming for those companies. They implemented different types of things, but just to give you our example, it's been really much easier to get our product registered in the US compared to what it was to get it CE marked in Europe. Despite that, and because I think, it comes also to who you are as a citizen. Business is important, but what you believe in is also important. The company was born in France. We have an important footprint in France and in Europe. And we wanted to start in Europe for those reasons as well. There are other reasons, but if it would have been only business reasons, we would have gone to the US straight away, and we would have forgotten about Europe. So there are, it's a matrix analysis, and the fact that we have this footprint was also an element that made us decide to start here. But it's not so obvious, to make this call.
And I think it's a valid point that you make about kind of like who you are as a company and also where you're based. Because let's say a company that's in the US right now, a startup company that's developing a product, historically they may have said, hey, let's go to Europe first. And now they might be saying, well, there's no point. Let's wait and see how MDR pans out. There's, issues with notified bodies not responding, not wanting to take on new clients, all this other stuff as well. They're busier with bigger companies. The burden is much higher, et cetera, et cetera. Mm-hmm. So now we go to the US first, and then we see how it pans out with Europe. So, I think where European startups may still really believe in that market, potentially we could argue that the strategy, the go-to-market strategy may have changed of other startup companies that are not based in Europe, and Europe is not such an attractive market for them, maybe.
Yeah, that's right. And I think it's not only a regulatory conversation here that we should have. I think when people tell you, well, but in Europe, when you get CE mark, you have access to a broad market overnight. It's partly true only because people have a tendency to forget that, CE mark is not the Holy Grail. Holy Grail is reimbursement of your devices. And it remains a responsibility of individual member states to define how reimbursement is managed. It's not a European decision. So even though you have CE mark, there is an additional hurdle, country by country, that you have to overcome to get your product really fully adopted.
And how does that impact how would that impact a strategy then of a startup?
It depends on the type of devices that you have actually in your portfolio. Either you have a product that is, let's say, intra DRG. And I don't want to be too technical here, but if it's a hospital product that is already paid with the DRG money that hospital receive for the procedures they perform, that's fine. It's just a pricing discussion that you're gonna have to have with them to define what is the right price point. If it's a product that will be reimbursed on an outpatient basis, something you're gonna buy in a pharmacy or something that is paid on top of DRG, then the discussion is completely different. And you have to think upfront, okay, if I look at the European situation versus, for example, the US, how complex will that be to get my product paid for, covered in those different markets?
And what about if we talk about investors then into startup companies? Is that, I mean, obviously, you're speaking with them regularly. What's their sentiment towards the new regulation, increased burden, you know, are you seeing investors maybe also not so interested in investing in certain types of startups or startups with certain types of strategies? Or
I would not say that. I would say first there is a big difference in terms of behaviors from investors located in the US versus Europe. First, because the amount of money that is invested for the same company in Europe versus the US is very different. They invest more massively in the US. So when you can get, for example, 2 million euros in Europe, you may get maybe 7 or 8 in the US, or maybe even more. So it's not the same type of discussion. What they want to see in both cases, all investors, they want to see a clear roadmap. They don't like surprise factors. They don't like you to come back to them and say, oh, by the way, I forgot that in my BP, it will take 1 year, 2 years more than planned. Because it's extra money that they might have to inject. And it's also a product that will not deliver at the time you were expecting. So, you know, it has a sort of domino effect that they don't really like.
Mm-hmm. You wrote a really interesting article with regards to positive discrimination and startups.
Yeah.
So tell me a little bit more about that.
That's another topic that is very, very close to my heart, another controversial one. I'm a big believer in the need to differentiate the way startups are treated versus large corporations. There are multiple examples of that. We talk about MDR. So for MDR, when we deal with notified bodies, the invoice that we receive from them for a service they provide is certainly, I'm not 100% sure, but is certainly the same in terms of rate per hour than a large company may pay for. I even suspect the large company may pay less because, you know, the volume of products they bring to the notified body is more important. So they better not lose this client. If you are a Medtronic, a J&J, you'd better keep this customer. So perhaps there are some discounts that startups won't get. So this is something that is, for me, not good. You should positively discriminate and say, okay, a startup has less financial bandwidth, so you should actually provide significant discounts for a service. By the way, that's what the European Medical Agency does. They have this small and medium enterprise group of people that collaborate with us, and we have special tariffs for services that are paid full price by larger organizations. So it's not impossible to put in place. That's one example. Then another one, you go to a congress, for example. If you wanna have a nice spot to demo your devices with a nice booth, etc. Well, you will pay exactly the same as again a large company. So I think that's not good. At least they should offer significant discounts to startup, or offer startup corners where we can have, you know, something nicely arranged, but specifically for startups to differentiate ourselves from the large companies. And there is no war between large companies and startups. It's just a fragile ecosystem that you need to take care of. Nobody can, you know, neglect the fact that we are part of this ecosystem and should treat us accordingly. And for me, accordingly means differently.
It's really interesting. I mean, just thinking about the point that you made about notified bodies, I guess kind of like the counter argument would be, you know, essentially it's time spent, isn't it? So that those people are kind of employed, and the time that they spend working on your projects would be the same time spent and the problem that we have is that, with the system that we have, it's a for-profit. A lot of these organizations are private and therefore, for-profit organizations. And so it doesn't make a business case to then directly cut the rates, I guess. I mean, I think that, but definitely is, when we talk about events, I'm surprised because I've seen some events do that, right? Or some events are more catered towards startup and have that flexibility on stuff like pricing, or if you want to have a stand, because for sure I think there it's a slightly different business model.
Yeah, it's moving, you're right, but not fast enough. And remember, startups, they need to be fast.
Yeah,
we have no time to lose. So if a Congress manager tells me, well, not for this year, but perhaps next year or the year after, for me it's already too late. It's now. I want to see things changing now, in a split second, if possible. Of course, it's not always possible, but it's too slow. And the argument that you mentioned is, for me, even though I can try to be in their shoes, it remains invalid. It remains invalid because if they discuss with me, I would tell them, but guys, okay, you spend time, which is the same with me or with a large company. But if we acknowledge that you need to differentiate the way we are treated versus those companies, you need to do something about it. And the concept behind it is really equity versus equality versus equality. And I took that example, in my article. When you are a couple and you pay for the rent of your flat, either you cut the rent price in 50-50, or you say, well, each of us will contribute to the rent according to our personal capabilities, financial capabilities. And they should do the same. So they should actually charge more the large corporations and less the smaller entities.
Yeah, I mean, listen, I'm coming from the startup background, so I know what it is to kind of always be looking for that discount. And I think it's a valid point, that you're making. Probably right now, in terms of the demand that there is for notified bodies, and the fact that they already have a massive supply issue. Everybody talks about the bottleneck. I don't think that's been really explored enough, and I don't think enough visibility has actually been given to that. But yeah, it's probably not going to happen.
No. And that's why I mentioned to you before that I'm a strong advocate of having all that work shifted to the European Medical Agency, because that would resolve the problem overnight.
Yeah, I mean, definitely if you have more of an agency centralized approach, that type of thing might be a little bit more, because then then we're not talking about a private, profit organization in the end, right? But yeah, it's definitely an interesting concept. Did you know that, so there was a stat that I read, or I was speaking with Martha Lawrence on another episode of the podcast, and she told me that only 3% of women founders get investment.
Yeah, I've seen that, and well, that's let me use the word shocking. I'm a strong advocate of having more women on board at all levels. Should it be as entrepreneurs? Should it be as a member of scientific or strategic boards in companies? We miss women, and it's, again, that's another example of something that is taking too long to change. However, I have good hope that things will evolve in the right direction. Although I hear what you said, there is, I think, a publication indicating that for every dollar invested in a company, when it's a company, let's say, managed by a woman, this dollar is 2 times more efficient than the dollar invested in a company managed by male. So it should be a signal for investors to pay attention to that, and not to to find excuses not to fund as they deserve projects managed by women.
I'd love to see that. I'd love to see a link to that report. That makes me happy as a female founder, at least of a services company. It's I think it's definitely not something we see enough of in medtech, right? But I was really surprised to see that it was only 3%. The stat is really low, I really think that investors need to be more conscious about that, because I think women have a lot to give, and have really unique ways of seeing things, because everybody has their own filters, right? And we see a lot of moves being made in big corporates in terms of women and leadership and gender diversity and that type of thing, but I feel it's yet really to filter down into the startup world as strongly as what we've seen.
That's true, and I think we try to make this change at our individual level, but even at our level, sometimes it's complicated. For some functions, for example, you struggle finding females. In tech, for example, it's more males. Well, in regulatory quality, it's more females, but so it's easier. But you have some jobs for which it's complicated to find women if you want to bring more on board your project. That's what we try to do at Dianosic, including in our boards. But it's not easy. But at least we act with this sense of need to bring more women and give them the opportunity to be part of what we do.
So I guess I'm conscious of time, and this has absolutely flown by. I have to say, it's been a very interesting discussion as well to get your take on things. There's always a final question that I love to ask people, which kind of frames the whole thing, right? So for you, what is the legacy that you want to leave on the world?
Wow. Well, I could, serve you the usual stuff, like I want to be a role model, for example. Okay. But I think that's valid for your kids eventually, or for in your personal circle. I think in the professional world, people are using too much of that. I want to be a role model. Okay. Until one day you get caught with the hands in the cookie jar, So I think nobody, can pretend he is or she is a role model, or because one day something happens and you are no longer one.
Yeah.
So I would, rather say I would love to be perceived as someone who is an optimist. Because I think I am, and if you are optimist, you believe you can change things without over promising, but you can try to do your best to change a little bit things in this world. But that's all I would actually say. I think. It's Churchill who said that I'm an optimist. It doesn't seem too much use being anything else. Okay, we can close with that.
I'll take that, because I really like the idea of approaching every sort of problem, scenario, situation with optimism. It's really the way forward, and it's basically been the tone of the whole conversation, moving to startups, be optimistic, and try and just give it a go. And I think that definitely has come through our conversation, Philippe. So it's been really, really nice to chat with you. I would encourage anyone who's listening to comment, get in touch with Philippe, read his articles if you want a bit of a controversy. And Philippe, it was an absolute pleasure having you on the podcast. Thanks for your time. And to everybody else, I'll see you on the next episode. Take care.
That was a shared pleasure. Take care too.